Bring you greetings from Raleigh, from the North Carolina Department of Insurance and Commissioner Mike Causey. And we appreciate you coming in today to learn more about Medicare. This is Medicare 101, the basics, and I'm Billie Lister. I am a home girl. I come from McDowell County, but I have since moved up on top of the mountain to keep me out of trouble. So I live in Jefferson and I'm field-based, so I work from home and I travel all over the Western End. I'm the Western Regional Manager for SHIIP, which stands for Seniors Health Insurance Information Program. And our basic goals with SHIIP are just to educate the public about Medicare, Medicare decisions, and options. So we have no dog in the fight, no skin in the game, so to speak. We don't care what plan you take. We are unbiased information. So hopefully after today's presentation, you'll know more about the basics of Medicare, which can be helpful to you as you make decisions. And in addition to that, you'll know that you have resources that you can access anytime you need them. So we have lots and lots and lots of handouts and information for you. All right, so today's presentation is all about the basic parts of Medicare, when to enroll, who should enroll, and how to enroll. And so we're going to begin with talking about what Medicare is. Medicare is a federally funded individual health insurance program, and it will provide insurance coverage for anything that's medically necessary, including services, besides services including supplies and equipment. So if you needed oxygen, for example, or a rollator or a walker. So those things are also covered under Medicare. So who's eligible? Well, anyone that's 65 or older, if you participated in the Social Security program or the Railroad Retirement System, that makes you eligible. If you're an employee of a federal, state, or local government, you're eligible. And your spouse is also eligible. And if you're under 65 and you're awarded disability, once you've been on disability for 2 years, you're eligible for that to roll over into Medicare. And then some folks, their disability makes them automatically qualify. So if you have Lou Gehrig's disease or end-stage renal disease, that makes you automatically qualify for Medicare regardless of your age. So let's talk about enrollment and administration of Medicare. Medicare, because it's federally funded or managed, is managed by the Centers for Medicare and Medicaid Services, or CMS. And that is a branch of the federal government, the Department of Health and Human Services. And the Social Security Administration is the only agency or entity responsible for enrollment in Medicare. So the only way to enroll in Medicare is to begin with Social Security Administration. Anybody calls you on the phone and says otherwise, they're lying. It's a scam call. Don't believe them. So the Social Security system is where everybody begins. And some of us, when we enter that phase of our life and we're enrolling in Medicare, we'll also go ahead and kill two birds with one stone and enroll in Social Security benefits kind of jointly. But they are separate things. You do not have to do one and or both. You can choose one or the other. But when you become eligible, you have to go through the Social Security office first to begin your process. Now, do you need to enroll in Medicare or will you be automatically enrolled? That depends. So let's talk about that. So if you're already collecting Social Security retirement benefits prior to age 65, they're going to automatically enroll you when you become 65. And so some folks will decide to take retirement early and they'll begin their Social Security benefits before they become Medicare eligible. And that's okay. If that's the case, Social Security Administration knows your birthday, and 3 months before your birthday, you're going to get your card and it's going to say, welcome to Medicare. And it's going to start when you turn 65. However, if you are not collecting Social Security at age 65, you need to understand when your enrollment window is, because you want to hit that on time to avoid any late enrollment penalties. Now, for those who are under 65 and you are on disability, after you've been on disability 2 years, it automatically rolls into the Medicare realm and you'll get a card. Again, you'll be automatically enrolled. Okay? Now, coverage will almost always begin the first day of the month you turn 65, or the first day you become eligible due to disability. Unless your birthday is on the first of the month, it begins the prior month on the first day of the month. So Medicare doesn't begin the middle of the month or on your birthday, okay? It begins on the first day. Now, for those of you who won't be automatically enrolled, I want you to memorize the information on this slide because this helps you to avoid late enrollment penalties. So if you're not collecting Social Security, this is important to you. You have a 7-month window to enroll in Medicare to avoid that late enrollment penalty. It's 3 months before your 65th birth month, the month you turn 65, and 3 months after. Now, I'm going to say it like my granny always said, don't lollygag. No, no, no. Don't put that off to that 3 months after. It's better for you to start 3 months before. So 3 months before, you begin with a visit or a call to the Social Security office, right? And they're going to start the ball rolling, and usually 2 to 4 weeks after you've gotten your application in, you're going to get your card in the mail. It's a red, white, and blue card. Looks all official, but it is paper. It's not plastic. It can't be plastic. It can't be laminated. None of that business. So all those callers that say, would you like a laminated or plastic card, are also scammers. Don't give them your number. That's not true. They're paper cards. And when you get them, that's when your real decision making happens, okay? This part is easy. It's a phone call or a visit to Social Security office. Now, yes.
You have to do it online?
You can do it online. I've had some folks that have had a little bit of a issue getting into their SSA.gov accounts. If you get locked out, just call the Social Security office. They'll get you back in. So once you've enrolled, you will begin the first day of the month that you're eligible. But if you waited those 3 months after your 65th birth month, it's going to begin the first day of the following month after you enroll. So let's say you turn 65 in the middle of May, and you don't enroll until sometime in May, and that would mean your Medicare will begin the first day of June, okay, instead of May. All right, so let's say we didn't hit that enrollment on time, and we missed our enrollment window. Now we have to panic a little bit, right? Now what are we going to do? Can I enroll as soon as I remember it? No. You have to wait for a general enrollment period. But January through March is general enrollment, and during this time, whatever month you enroll in, Medicare begins the following month. It won't necessarily mean that you're avoiding a late enrollment penalty though. So remember, if you were supposed to enroll at 65 and you don't, you will be subject to a late enrollment penalty. Now, anybody that begins this knows that coverage begins the first day of the following month. Let's talk about that late enrollment penalty. What does that mean? Well, if you were supposed to enroll in Medicare and you miss it, you have 10% of a late penalty applied to your Part B premium. And that 10% is 10% per year from the premium that year. So whatever Part B premium is for each year you missed, there's 10% of that adding up every year until you comply and enroll. Okay? So, just a side note, that penalty is forever. It never goes away unless you become eligible for low-income assistance. If you become eligible for extra help or Medicaid, they'll waive that late enrollment penalty. Now, some folks will not have to worry about a penalty because they're still working and they're covered under their employer group health plan. Which brings us into special enrollment periods. So, if you are actively working full-time and your employer, if you're 65 or older, your employer has at least 20 or more employees, or if you're on disability and you're younger than 65 becoming eligible for Medicare, if your employer has 100 or more employees, you can delay taking your Part B and you won't have a late enrollment penalty. However, if your employers do not have at least 20 if you're 65 or 100 if you're under 65, if it's a small employer and you don't take this, then Medicare may not issue you a late enrollment penalty, but the insurer will. because they would be secondary to Medicare, and Medicare becomes primary. So it is, in essence, a penalty, but not one issued by the Social Security Administration. So it's not issued by them and called a late enrollment penalty, but it is technically a late enrollment penalty because you should have had Medicare. So it's very, very important to know. But if you are working for a large employer that has more than 20 employees, and you turn 65 and you're still working, you want to keep that employer plan, that's fine to do so. You can keep that plan, and when you decide to stop working and stop taking that employer group health plan, you then have an 8-month period to get Medicare A and B without penalty. There are some hoops to jump through. There are some forms the Social Security office will require your employer to fill out on your behalf, just certifying your employment status, certifying the dates that you stopped working, as well as the dates of coverage for your health insurance. But if you get that paperwork turned in, you'll be okay there. But it is important to know that there are additional things that you have to do to avoid that penalty. So let's talk about how we enroll. So we talked earlier about you have to go through the Social Security Administration. But I will tell you, if you go to ssa.gov, all of the forms are there. You can download, have your employer fill them out, or you'll fill them out if you don't need the employer certification. And you can fax those in. You can hand them in person. You can do it completely online now. Okay? You can also call them Monday through Friday. I think calling is very easy. We know that Social Security offices are not in every single town anymore. So depending on where you live, your Social Security office might not be in your town. It might be out of town somewhere. So it makes it really, really easy, but you can also make an appointment, and now you can just show up without an appointment. So where I live, my Social Security office is Wilkesboro. It's about 45 minutes drive, but I find it easier sometimes to go in person and sometimes to call on the phone. Depends. Depends on what I have to handle and what documents they might need. And some things will require you to go in person. So if you're like me and you did this first, I went there and tried to create an account, and I answered the questions wrong. And they couldn't verify it was really me. And I locked myself out of my own account. But there's only one way to unlock it from there. I had to show up in person with all my documents. So that required a drive down there. It took me like 10 minutes. It's not, once I drove there, it took 10 minutes in the office. It's not a big deal. But depends on your preference, but they're all pretty easy. I find them to be fairly simple and straightforward. There are 4 main parts of Medicare, and I want to pay close attention to the word part versus the word plan. There are a lot more plans than that, but there are 4 main parts or components to Medicare. So when you go to the Social Security office to enroll, what are you exactly enrolling in? Well, you're actually only enrolling in Part A and B, okay? That's what we lovingly call Original Medicare. So A and B is managed by the federal government, and that's your basic Medicare benefit, and that's what that's what Social Security starts you out with. Every single person starts there. So when you get your card, A is hospital, B is medical. It's everything outpatient, right? Now, is that all we need? Unfortunately, no, it's not. So if we keep Original Medicare, we also need a Part D drug plan so that we can cover outpatient medications. And we can choose, if we don't want to keep Original Medicare, to take an Advantage plan. And if we take an Advantage plan, it kind of takes the place of A and B, but you still have your A and B card. You still need to hold on to it. You still may need your Medicare number. But instead of the federal government managing your benefits, you're going to choose a private company to manage them instead. Okay? So I'm going to break down that choice for you, and we'll talk about it. So now that you have your red, white, and blue card, what in the world do you do now? Well, you have to choose the original path or the Advantage plan path. Let's talk about the pros and cons of each and what those plan decisions mean. So we're going to start with Original Medicare. So Original Medicare covers A, hospital. So anytime that you're inpatient at any facility, including an inpatient hospice care program. And it can cover some home health, and I'll give you an example of when that would matter. If you're placed, let's say you're 3 days in a hospital and you have a surgery or a procedure and you're deemed not able to really go home, but you don't need hospitalization. So they send you to skilled nursing for rehab. And you get to rehab and maybe you need a particular service that the skilled nursing facility does not offer as part of their package of care. So they may bring in a home health nurse and she or he, maybe physical therapy or occupational therapy, whatever. Those folks come into that skilled nursing facility and provide that service to you. They can bill that under Part A as home health, even though you weren't technically at home. But you were inpatient, so Part A pays for it. Also, blood transfusions or any transfusion done while you're inpatient is covered under Part A. Now, Part B is all the other stuff. So any doctor's visits, any outpatient surgery, outpatient services like dialysis or chemotherapy infusions. As long as you're going home at the end of the day, that's covered under Part B, including durable medical equipment, all the other home health and preventative services, and blood transfusions done outpatient, all covered under Part B. All right. So what in the world is not covered by original Medicare? Well, drugs. Medications are not covered. That's why we say we're requiring you to select a drug plan or to have some alternative way to cover drugs, because that's not going to be covered under A and B. Routine dental care is not covered, but don't panic if you get into a car accident, break your jaw, or you get oral cancer. Those kinds of things are covered under Medicare, but not dental cleanings or cavities or that sort of thing. Routine vision care and eyeglasses, not covered under original Medicare. However, if you get cataracts or glaucoma or some kind of a health condition with your eyes, that is covered by original Medicare, so you don't have to worry about that. Hearing aids also not covered, but you can go to the doctor to find out you're deaf, but you probably already know that. But you can still go to the doctor and hear it, maybe, or not. Might be why you're there. And I know, I shouldn't joke about that, but I'm hearing impaired, so I think I get away with it. Foreign travel, not going to be covered under original Medicare. However, if you have the right supplement, you will have some foreign travel emergency coverage under certain supplemental plans. And cosmetic procedures and treatments also not covered under original Medicare. So get all of that sort of thing done before you start Medicare. It's not going to be covered. And long-term care, which is defined as more than 100 days inpatient at a skilled nursing facility, that will not be covered under Medicare. All right, so now we see this pretty red, white, blue part. Let's break down the cost of it. So, Part A normally is premium free, meaning you don't have to pay anything for Part A. Okay, if you've worked 10 years or 40 quarters and you've paid your FICA taxes, then that is going to cover you for your Medicare Part A premium. Now, if you've not, you can see there is, you can buy into Part A, okay? It's a little pricey, but most of us will get it for free. But there is a deductible of $1,632. So that is the first point of sale. When you get into the hospital, you step a toe in the door, you've racked up $1,632 deductible. I promise you don't even have to be there 5 minutes, and you're going to meet that deductible. But after that, you're going to get up to 60 days of inpatient care at no additional copay. That's pretty good. Now let's say you go home for a couple of months and then something else happens and you have to go back. The deductible starts over. That's unfortunate. Yeah. If it's for the same event, let's say you went home for a couple of days and then something happens and you relapse a little bit and you need to be put back in the hospital, you're still under the same deductible, you're okay. But you do have to meet the first $1,632 per benefit period, okay? Once you've met that deductible, you get 60 days of inpatient care at no copay. But once you hit day 61, That's when it starts to hurt. Because on day 61, they're going to charge you $408 per day. So your goal is to get better and get out, right? You don't want to stay there. But $408 per day for day 61 through 90, and at day 91 through 150 are lifetime reserve days. That means only once in your life will they pay that particular day of hospitalization, and your copay is $816 per day. And they're only going to do that once in your life. So you use those days up and you're done with them. So it's very important to keep track. If you have extensive medical issues that require long stays in the hospital, keep track of those lifetime reserve days because they only pay them once. If you are in the hospital for at least 3 days but released to rehab, you get skilled nursing for up to 20 days at no copay. But day 21 and beyond, from day 21 through 100, you pay $204 per day. And so we can see that there are some gaps for Part A that we're coming out of our pocket, right? And most of us might not fear this amount of money too much because we think, well, we'll probably be pretty healthy and we might not need it. But you never know, and if you did have a bad health year and this was coming out of your pocket, you want to be thinking about that and how you're going to come up with the copays and the deductibles for Part A. Now, this is what the chart looks like. I know you're not going to see it up here. Don't even try. It's okay. It's in your packet. It tells you the same thing we just discussed. So now let's talk about Part B. So the premium this year is $174.70. If you have an income that's greater than $103,000, if you're single, married couples with incomes greater than $206,000, your premium could be more. That means you'll be subject to IRMA. It's an income-related Medicare adjustment. And so if you have higher income, the $174.70 may be higher for you. But there is a deductible of $240 per year for all approved Medicare charges. So that is by calendar. Once and done for the calendar year, you pay the first $240 and then Medicare kicks in with you, and it's an 80-20 split between you and the federal government. Okay, now, I would love to tell you it's just that simple, but I would be lying. It's not 100% that simple. It's not truly an 80-20 split because sometimes doctors do not accept the Medicare allowed amount. So let's say you go into the dermatologist and you know they always want a piece of it, right? They got to have their little piece of flesh. So you go in there and that dermatologist takes a little something and says, well, I took my little part for the day and I'm going to bill you $500. Medicare may look at that bill and say, that's only worth $300. Well, the doctor just lost $200 in that negotiation, but Medicare is going to pay 80% of the $300 they think it's worth. You're going to be due 20%, but the doctor can charge you 15% of what they lost. 15% of that's called excess charges, okay? So the $200 that they lost, they can charge you 15% of that. Do all doctors charge excess charges? No. Some accept Medicare assignment, and they're okay with it. Some will not. So the thing that's important for us to know is that there is such a thing as excess charges, and we're 100% on the hook for them. Yes?
How do you know this when you go to a doctor?
You can ask the doctor. But most of us don't find out until we look at the explanation of benefits. Yeah, look at the bills. Okay, so if your doctor decides to charge excess charges, you have to cover 100% of those. They are not Medicare's problem. Okay? So now that we've heard about this, and that's what the little chart looks like that's in there. Also, I will say that you usually have to pay for the first 3 pints of blood, and then after that, they're covering you. Okay? So there are some things for you to look at on that chart that's in your packet to let you know kind of what you're looking at. Okay? You have a deductible, and then you have your 20%. Now, here's the bad thing. Your 20% has no maximum out of pocket. There's no ceiling at which the hemorrhage stops if you have a bad health year. So if you keep original Medicare, there are lots of good things about it. One, there's no network. You can tap dance your way into any doctor's office. Pretty much 99.9% of doctors and providers will accept Medicare, okay? And they don't have to worry about it. There's no network. You don't have to have referrals. There's no headache. It's super easy. But it's also kind of expensive, right? So if you're on the hook for the deductible's not that bad, but that 20% just keeps going. And I could potentially bankrupt myself with original Medicare if I have a bad health year, right? Because if I rack up $1 million in charges because I had a heart attack and I spent a month or 2 months in ICU and a helicopter ride, you can see it can keep going, right? It can be bad. So we want to be prepared for that's going to happen, okay? This is where supplement plans come in, and they are very beneficial. Medicare supplement plans are often called Medigap policies. Now, you hear a whole lot on TV, and half the rainforest gets chopped down just before you turn 65, just to inform you about all the possibilities that are out there. So I want to tell you that it's all a sales pitch, and it's great. There's some good information out there, but it can be very confusing. When everybody says, I'm the best, pick me, pick me, pick me, how do you decide? Well, who do I listen to? What do I pick? So this is where I think SHIIP especially shines, because I'm not affiliated with any company. I can tell you honestly how many plans are available, who sells them, how to hook up with them, what they're going to offer you. But the main thing to know about supplement policies is that one, you're on a time clock for guaranteed issue. Two, they're standardized. That means if there are 32 companies selling Plan G, for example, in your zip code, there is no difference between Company A and Company B. Well, let me say Company 1, 2, and 3 because we got enough alphabet going on. So Company 1 through 32, they're all the same. A G is a G is a G, an A is an A is an A. It doesn't matter what company you pick. Now, that being said, there are differences in policy types, rating classes. So it's important to understand what you're looking for, okay, and what you really want. So when you go in to sit down with an agent and choose a Medigap supplement, go into it having all the facts beforehand. But you do need to understand your guaranteed issue rights. So the first minute that Medicare A and B are both on board at the same time, your time clock starts. You have 6 months to select your policy. In that 6 months, nobody selling the policy can say no. They cannot refuse to cover you regardless of how good or bad your health is. They cannot base your rates on your current health. So they can't ask you health questions and say, oh, well, you're diabetic, so you're going to pay $100 more. They cannot do that. Can't hold those pre-existing conditions against you. And so in that first 6 months, I have a magical window where nothing about my health matters. And I'm getting a policy if I want one. Now, if I wait beyond that 6 months, does that mean I cannot get a policy? Well, it means I can't get one because I have chronic health conditions. But it doesn't mean you might not be able to. So it's all about your health and your current situation, whether or not you'll be offered a plan if you wait beyond that 6 month window. So I will tell you, if you have really complicated health issues, it's unlikely you would get a supplement policy offered to you beyond your 6 months of guaranteed issue. Okay? So it just depends. But if you're in fairly reasonable health, you probably can shop around and get a different plan. Now, plans are designed by letters. I know you want to throw something at me. I didn't create that. Someone else did. And so it's a little confusing because we just talked about Medicare Part A, B, C, and D. And now I'm telling you there's also Medicare supplement plans A, B, C, and D, as well as F, G, K, L, M, and N. And all plans cover a basic group of benefits, and then each different letter covers a different set of gaps, okay? That's why they call them Medigap policies. They're meant to fill in the gaps for you and keep you from going bankrupt in a bad health year, right? And so coverage is the same from company to company, but you know what's not? The premiums. So even though a G is a G is a G, One particular G plan from one company may cost $100 a month, another may cost $400 a month. What is the difference in coverage? Nothing. It's the company and their premiums, okay? So now the rating classes or the rating types may be different, and we'll talk about that too. But I'm not going to address today how Medicare works in regards to other insurance coverage, like if you have TRICARE or VA benefits or COBRA. But if you come to a SHIIP counselor, we will tell you whether or not you need a supplement. If you have other things like Medicaid or TRICARE, you may not need a supplement to help you with those gaps. You may already have secondary coverage. All right, so this is not the best depiction on the screen. Now, CNF are no longer available to new Medicare recipients, so we'll leave those off of the consideration. But you can see the most comprehensive is going to be a Plan G. G is the only one currently available to new Medicare beneficiaries that will cover Part B excess charges. So, what's the difference between a G and a D? G covers excess charges, and it's a few dollars more per month. Okay? So, when you're looking at this, you can see that all of them are going to cover the part of your part of Part A. So, your deductible and your per day copay. All covered on all plans. And Part B, copays, that 20%, covered by all of them, with the exception of K&L, which cover a percent of your 20%. And then the first 3 pints of blood that would normally be your problem and hospice care copays, all covered by all plans except K&L cover percents. Now, when we start looking down at skilled nursing facilities, Part A deductibles, Part B deductibles, all of that, the excess charges, that's where these plans start to look different, okay? So, when you're looking at these plans, there are lots of things to consider. One, what's the likelihood that I'm going to need a whole bunch of extra coverage, right? And I'm going to say that supplement plans are like comp and collision on your car, whereas original Medicare is like liability. We all needed the liability, but what happens when a deer jumps out in front of us or a tree falls on our car? If we don't have comp and collision, we're in trouble. And so this is kind of the comp and collision of Medicare, right? We're going to pick a supplement plan. And do we want one that covers just deer jumping out, or do we want one that also covers trees and hail damage, right? So we could have trees, hail damage, and a deer all in the same year. So we want to have really good coverage. The things that make these very different are the types of plans, whether they're attained age, issue age, or community rated, and that's mainly pertains to how they can increase your rates over time, okay? So issue age, start out a few dollars higher, but they lock in that price, and just because you have another birthday or you get older does not mean that the policy goes up. It can only increase based on cost of living or profit and loss, right? So issue age kind of stay more stable over time. Community rated is based on the number of members in the pool, and attained age, which are the most common policies, are based on your age when you have the policy. And as you age, you attain a new age, so you attain a new premium, okay? Dare to have a birthday, we're going to give you a policy increase, and that's how those work. And so when we look at these different types of rating types for policies, that can kind of help you to understand how your rates will go over time. But rest assured, all supplement policies increase as you age. They're going to increase over time because of cost of living, okay? Because of profit and loss, all of them. And others can increase based on other factors, okay? So you want to look at that. And then you want to look at whether they have any special thing about them. So when we're looking at those rating types and rating classes, are they just a regular G plan, for example, or is it a wearable policy, meaning I have to wear a Fitbit, or is it a policy that would require me to jump through a specific thing, okay? So maybe need a high deductible at the beginning, and then it'll be a normal G plan later on. So we'll look at those different factors. Having someone sit down and explain that to you and walk you through that process so that you can make an informed decision is very important. And I'm going to encourage you to do your research before you choose a supplemental plan. But the basic plans, they're all going to offer the same basic coverage, which is here, and that's set in stone. Once you get it, you're guaranteed you get to keep it, as long as you pay the premium. So, with original Medicare, we do not have to have the supplement. We can choose to pay the 20%. The supplements are a good idea. With drug coverage, you do need to have something for drug coverage. So let's say you said to me, well, I don't take any medication, so I don't think I want a drug plan. I can't force you, and you don't have to. You can opt not to. But if 5 years down the road you become diabetic and now you need expensive insulin, and you want to get a policy then, you would have a late enrollment penalty. And it's 1% per month that you're not covered. And that is 1% of the base premium for that year. So every year you're not covered, another 12% gets added on. And it's lifetime late enrollment. So my advice to most new beneficiaries is unless you have VA coverage or some other type of coverage for drugs, you need to select a drug plan. So this year there's even a zero premium plan, so it's like kind of a no-brainer. Of course I would take a zero premium plan, but in years past we've not had a zero premium drug plan. So we would say, well, choose the cheapest plan, $4 or $5 a month. And that's going to be better than paying that late enrollment penalty later on. So the main thing to know is that there are tons of plans, and you can see them all on Medicare.gov. And as you're looking at these plans, they're all going to charge you a monthly premium in exchange for a formulary list. Every plan has a different list of drugs they cover. So you want to make sure that your actual drugs are going to be covered under the plan you choose, that you're happy with the premium, that you're happy with the deductibles, and you can look at those plans on Medicare.gov or with the SHIIP counselor, and we'll help you look at that and make sure that the plan you pick is going to be the best plan for you. Okay? Now, unfortunately, these plans change every year. So you might have a plan this year that you love, but it doesn't mean that that plan is going to look identical year after year after year. So every year during open enrollment, which is October 15th through December 7th, that's your opportunity to look at what that plan is going to be like next year and make a decision. So during open enrollment each year, you need to come in with your list of medications, sit down, enter them all into Medicare.gov, see what your plan looks like, and choose the best plan for you going forward. You can make a change during that time. And I would say it's probably a 50-50 split on whether you have to change every year, but you will change at some point. I promise you. Everybody changes eventually drug plans, and that's normal and okay. They also change which pharmacies they work best with. So if you have a pharmacy you really like and you don't want to change, you really should do a review. But like I said, the formularies change annually, the premiums change, the deductibles change, and the in-network pharmacy changes every year, so you want to look at those. When can you enroll in a Part D drug plan? Well, during your initial enrollment. So when you first become Medicare eligible, you have an opportunity to pick your drug plan at that time. And then, of course, the annual enrollment period, October 15th through December 7th, and that coverage begins January the 1st. Okay, so after open enrollment ends, the coverage begins the following January. So when you see pumpkins on the ground, it is time to go look at your Medicare plan. You cannot mess around and miss that. You want to hit that on the top. For folks who listened to Joe Namath and they picked a plan online, and they said, I'm going to take an Advantage plan, me. Well, they have a chance to change. They have their own open enrollment period. So anyone who has an Advantage plan, the first quarter of the year can change it. Okay? So if you didn't change it during OEP, you can jump on board during Medicare Advantage open enrollment and switch it. Yes?
In that special period with a Medicare Advantage, you have to go with a Medicare Advantage plan if you want to switch?
No.
You can switch either way.
You can switch, well,
Medicare plan or Medicare.
if you have a drug plan right now, you cannot make any changes.
Oh, this is.
But if you have an Advantage plan, you can change to another Advantage plan Or you can leave Advantage and come back to original Medicare and pick a drug plan.
Because a lot of the Medicare Advantage plans has a
Includes your
drug
drug.
plan
Yeah.
in it, so
Yeah.
you can go either direction. But then I guess you have to, if you go back to a Medigap plan, then you have to sign up for a Part D plan too.
Well,
If you went from a
it's
Medicare
not a
Advantage.
guaranteed issue back for your supplement. It's only guaranteed that you get your drug plan. So if you're leaving an Advantage plan during Medicare Advantage open enrollment, you are guaranteed to pick up a drug plan during this special enrollment window, but you're not guaranteed to get your supplemental plan back.
Okay.
So you only have that 6-month window of guaranteed issue, remember? Beyond that, you have to go through medical underwriting. So if you were riding the Advantage plan train for a few years and then you decide, I want to go back, you can't necessarily get your supplement unless you can pass medical underwriting. So you'll contact an agent, you can do some shopping, but you may have to face the fact that you won't be offered a supplemental plan.
But really, I bet a lot of people do not realize this.
A lot of people don't realize that until it's too late. Now, you do get a once in a lifetime free trial look at an Advantage plan. So let's say you had a supplement and you had that for a few years and you thought, well, I hear all this about free meals and free transportation and dental and vision. I'm going to try that out. I really want to try that out. And then you get the plan and maybe it was okay, but you realize some of your doctors left the network and you can't go to the doctor you want to see anymore and you want out. If it's been only the first time ever in your life that you tried an Advantage plan, you have 12 months that you could go back home and the supplement has to take you back. But if it's been longer than a year, the supplement does not have to take you back if you want to come back. You have to go through medical underwriting.
That's bad.
It can be very bad for some folks. It can be good for others. Now, some people try Advantage plans and they love them. They love them. And some people hate them. So it's really depends on your certain situation. Medicare is not one size fits all. So I know that when you begin Medicare, as you're approaching Medicare, you start talking to friends and family and neighbors and people at church and people at work, and everybody's got their own opinion. Somebody will say, well, I got this plan and it's an Advantage plan. I love it, love it, love it. It's great. And other people say, oh gosh, don't do that. I got this supplement and it's the best. It's not one size fits all. What works best for one person is not going to be what's best for another. So you really have to think about it.
Yeah, so, okay, if somebody's 62 and this lady, and they have Medicare Advantage plan, when they become eligible for.
At 65, they get a new window.
You get a new window.
They get a new window of
But if you're
eligibility for
over, if
a
you're
supplement.
65 or over and you pick the Medicare Advantage plan,
As long as it's within the first year,
yeah,
you got your trial right, that first time ever, that you can switch out of that Advantage plan and come back to original Medicare, and you're guaranteed issue at that point. But beyond that, you are not guaranteed anything. So I try to caution people to think hard. If you are vacillating between the decisions, it's easier to start with original and your guaranteed issue, and then if you don't want it, you can drop it. Because anybody can get an Advantage plan during open enrollment. You can never be turned down for Advantage plans, but you can be turned down for supplements. So you want to think about that. It doesn't mean everybody should take a supplement. Not everybody wants or needs a supplement. Some people do better with Advantage plans. So we'll talk more about those in a minute. So if you're going to go with original and you want to get your Part D drug plan, you can do that any time you have an open enrollment period, okay? Now, some people will get special enrollment periods if they qualify for extra help or become Medicaid eligible. That gives them extra opportunities throughout the year to make changes to their plan. Which, of course, segues perfectly into this slide, because we do want to talk a little bit about the extra help program that's available. If you have limited income and resources, limited assets, you may be eligible, and that eligibility for the extra help program is determined by the Social Security Administration. Any SHIIP counselor can help you fill out that application, but you can also fill it out at ssa.gov. And when you apply for this, it can not only give you 3 more chances of change throughout the year to change your plan. But in addition to that, it can lower or even eliminate your monthly premiums, your deductibles, and your co-pays for your drug coverage under Medicare. All right, so that gets us through the original Medicare path. Let's talk about the Advantage Plan path, because you will hear both good and bad, right? There's always 2 sides of every coin. And again, there's no right or wrong here. It's just 2 different ways of accessing your benefit, okay? So let's talk about Advantage Plans. Instead of the federal government, really the federal government doesn't manage your plan, but they administer it and they pay all the bills, right, when they come in. But if you said, I don't want original Medicare, I want to look at an Advantage Plan, you're choosing a private company to manage your care. So you're trading in the no network for a potential network, okay? And you have different types of managed care plans under Advantage Plans. So let's talk about those. So these plans have to be approved by Medicare, first off. So there are certain rules that they have to follow. They have to cover certain services that would have been guaranteed under original Medicare. It's still part of the Medicare program, but now instead of Medicare paying the bills, there's a private company that's going to collect the claims and decide what gets paid and how it's paid. So Medicare pays the plan on your behalf. So there's a certain dollar amount that Medicare would have spent managing your claims. They take that money and they give that to the company you choose. So even though it says 0 premium and you're not having to pay for, believe me, you're paying for it, right? The tax dollars are being allotted to that plan. So don't think that they're not getting paid to take care of you. They are getting paid to take care of you. But you will probably, 99% of the time, unless you have Medicaid, you're going to be given a network to use. Now, can you go outside the network? Absolutely, yes. But if you do, you may have to pay all of it, or at least the majority of that claim will be coming out of your pocket. So it's very important to understand the difference between an Advantage plan versus original Medicare, because the network can make or break whether or not you like the plan, okay? Now, the unfortunate part of an Advantage plan is that the network can change at any time throughout the year. And you may not be able to make another change until the next year, right? So let's say you did diligent research and all of your doctors were in this network when you signed up for this plan and you loved it. But then April the 1st, when you can't make any changes, your doctor's, peace out, I'm done. I'm leaving the plan. What are your options? Well, you can go to your doctor and just pay out of pocket because you don't want to change, and then next year choose a different plan that your doctor cooperates with, hopefully, or you can change your doctor.
It's like somebody.
And you can pick an in-network provider. Now, how often do doctors leave the networks? I can't tell you that. I don't know. I can say I have people call me pretty often that their doctors left the network, or they thought their doctor was taking the network, and it turns out the doctor accepts it but isn't in network. They just accept it. And that was a big difference, right? It's a difference in language. So they got confused and they're in the wrong plan and they can't figure out what they should do about that. So these plans do change zip code by zip code. So even if you have a nationwide network, a plan that literally has options all over the United States does not mean that the network is the same. So if you have this zip code today and you have an Advantage plan here, and then you switch over and you keep the same plan but you move to a different zip code, the network is going to be different, potentially. So even if it's just the next county over. So you may still have to change your doctors even if you're keeping the same plan. But the great thing is, if you change zip codes, you get a special enrollment window, and you have to change plans because you have to report that you changed. You have to re-enroll in your new zip code. So plans do vary county by county, and you get this additional window, the first period, the first quarter of the year, where you can go ahead and change that Advantage plan if you want. What Advantage plans do is instead of saying, like a supplement, you're gonna pay the same monthly premium whether or not you use it. With Advantage plans, you pay co-pays when you use the plan. Most of them have 0 premium options, but some of them have small premiums, but the premiums are very low on Advantage plans, if they've got one at all. And unless you're using it, you don't spend any money. Yes.
Are you still billed the 174 Part B?
Yes, you are. Part B does not go away. You still have to pay your Part B. Now, you'll hear some of the TV commercials say, well, you're going to get back part of your Part B premium. That depends. One, it depends on the plan you chose, right? And it won't be the whole 174. No, at least not in this county. Not in any county in North Carolina that I know of. There are no premium-free plans unless you have Medicaid that pays that premium for you. So when we're looking at these plans, they may give you back $35 of your Part B premium or $50, depends on the plan you pick. They may not. Chances are most of the plans won't, but even if they do, you gotta look at the give and the take of the situation, okay? So just know when you're looking at an Advantage plan, pay very close attention to what they do and do not pay, and pay attention to the network. Look at the formulary for the drugs. Make sure it's going to cover your drugs because you want it to include drug coverage. You want to choose a plan that offers you what you need. And just know, and you'll hear that you get free eye care, free vision, free dental. It's not free vision and free dental. It's an allowance. You get a certain dollar amount and you have a certain network. And if you follow the rules and you get prior authorization, yes, you'll get care. But it's not a free-for-all. It's not make an appointment at any dentist and walk in there and get whatever you want done. That's not how it works. I want to say that it is, but it's not. So you have to understand what you're getting in exchange for this. Now, a lot of people love it, especially folks who don't have 50 ologists, right? You don't have 500 specialists and a whole bunch of procedures and a whole bunch of complicated health issues, because then you may potentially be paying nothing. Some of these plans, as long as you're willing to see an in-network provider, you may get to see your primary care physician for free. Might not even have a copay. Or your copay may only be $5 or $10. That's pretty good, right? So I can go anytime I'm sick and I feel pretty good about that. But if you come into me and we're looking at Advantage plans, I'm going to ask you a lot of nosy questions. How flexible are you with changing your specialist if your specialist is not in the network? Are you willing to change? And if not, are you willing to pay out of pocket? So we're going to look at those different types of plans. So PPOs and HMOs and all that's very important to understand what those mean. So for example, with the PPO, there's some coverage outside of the network and there's a maximum out of pocket for out of the network. But under an HMO, there's no coverage if you go outside the network. And in addition to no coverage outside the network, there's no maximum out of pocket for that non-covered service. Meaning that if I'm racking up a whole bunch of bills, there's no stopping that. It just keeps going, right, out of my pocket. So it's important to understand how they work. If you know how they work, you can work it so that you get what you need covered, right? But you've got to be willing to understand the policy and how to use the policy. Now, some people find these more complicated than other people, okay? So I've had clients come to me and say, I just don't understand how, they promised me this and I just can't use it and I don't know how to get it and what do I do? And that's where we're getting on the phone with these folks and saying, okay, you promised this, how do we get it? What hoop do we need to jump through to get it? But it's not unobtainable. So they're not lying when they say that things are available. But when they say you get free meals, no, you don't get free meals delivered to your home every day. What you get is if you've been in the hospital for 3 or 5 or 7, depends on the plan, however many days, when you get home, you're going to get a few meals delivered in the beer cooler on your doorstep. That's what you're going to get for a few days to transition you from being hospitalized to being at home and caring for yourself. You're not going to get everyday meals delivered to your home. So it's not like, wow, I'm going to get free lunch and free breakfast and I'm going to get free. It's not the way it works. I want to say it is, but it's not. So they're not lying, but they are not telling you all the details that you might need when you're hearing these commercials, because they don't have that much time. I could talk 3 or 4 hours on an Advantage plan, and you still won't know everything and how it works, right? So it's important to understand the plan that you're picking before you choose it. And to understand the ramifications. If I pick this plan, when can I make a change legally? How long am I stuck with it if I don't like it? And can I ever go back and get my supplement back? Well, that depends, right? So, all right, so when can you enroll in an Advantage plan? Well, of course, your initial. When you first became eligible for Medicare, you can also pick your Advantage plan at that point. And then during the annual Medicare open enrollment period, and that's October 15th through December 7th, and then January through March every year is the Advantage plan open enrollment. And then you might get special enrollment periods that you have to qualify. So you move to a different county, or you go to rehab and then you come home from rehab. You get extra help or low-income assistance. Those are going to give you extra opportunities to make changes to the plan. So just as a recap, comparing original Medicare to Advantage plans and how they work, they're both going to cover hospitalization and medical coverage, okay? Under one, Medicare directly, the federal government manages the care, and under Advantage plans, it's provided by a private company that contracts with Medicare. And then under original Medicare, you have no network. You go to anybody that'll take Medicare, and that's almost everybody. Versus Advantage plans, you're going to need a network. You're going to have to stay in that network to get the most out of that plan. Under both of them, you're going to pay a premium for Part B. But under an Advantage plan, you may have an additional premium. But they may also cover extra things, like give you $300 to buy a pair of eyeglasses per year, right? They may. They may say you get $1,000 of dental care, but you got to find an in-network provider to do it, and they have to file a treatment plan and get prior authorization to do any fillings, right? So you may have some hoops to jump through, but you may have some additional services that you can get that wouldn't have been available to you under original Medicare. Now let's talk about those Medigap policies versus Advantage plans. So they're both private companies, right? But under Medigap policies, they not only have to follow Medicare rules, but they also have to follow State Department of Insurance rules. Advantage plans just have to follow federal guidelines because they contract with Medicare. The Medigap or supplement policies only work if you keep original Medicare. You cannot have both an Advantage plan and a supplement. If you have an Advantage plan, that's all you have. If you have original Medicare, you can opt to have a supplement, and you will also have a drug plan. So that's a little bit different. A Medigap policy is just meant to cover gaps in original Medicare, like your deductibles and your copays, right? And it's only for Medicare covered services. So in other words, if Medicare says, no, that's not anything Medicare covers, then the supplement will also say, no, not going to be covered. But if Medicare says that's approved and I'll cover it, then your supplement also has to cover it. Okay? Under Advantage plans, they have certain rules that Medicare gives them for coverage, but they can have different rules. So, for example, if your doctor wanted to run an MRI, this plan may say, no, you can get a CAT scan instead, it's cheaper. So it depends on what they deem medically necessary. But their rules can differ from Medicare's rules, okay? They may require step therapies, for example, and say, well, try this lesser treatment first, and if that fails, then we'll pay for this more expensive treatment. So that's a little bit different. Again, it's managed care. It's what most of us are used to it from when we worked. All employers have managed care plans. It's exactly the same thing. But now you're retired and you still have managed care. So that's kind of what you're comparing it to, is managed versus not really managed. You just go and pay your part. So a Medigap supplement, you have to have Part A and B. And if you have an Advantage plan, you also have to have A and B. You can't have just one. You got to have them both. And yes, you're going to pay the premium for Part B, but you're also gonna have to pay a premium for your supplement. And with an Advantage plan, yes, you'll pay the premium for Part B, and you may or may not have an additional premium for the Advantage plans. A lot of them are premium free, so you may not. So let's talk about Medicaid and Medicare services combined. So assistance is available if you have limited income and resources, and the determination for this program is made by the Department of Health and Human Services. So your local social service agency will determine whether or not you're eligible to get your premium for Part B paid for you. And if you weren't eligible to get premium-free Part A, Medicaid may also pick up the tab for the premium for Part A for you on your behalf. So the only way to know if you get Medicaid is to apply for it. And again, SHIIP counselors can help you with that application process. All right, so I do want to talk a little bit about preventative care, because the one thing that Medicare really does great is pay for preventative care. And I want folks to really remember that preventative care costs you nothing under Medicare, whether you take an Advantage plan or whether you take original Medicare, doesn't matter. You're guaranteed preventative care at 100% coverage. That's wonderful. That means you can get all the vaccines that you want to get that are recommended for your age and gender. And in addition to that, you can get preventative screenings for things. But there are times where it might not be covered like you think. So a great example is a colonoscopy. I know nobody likes them, we don't want to talk about them, but we need them. And if you go in for a preventative colonoscopy and they find a polyp, it's now a diagnostic test. It's no longer preventative care. So what you thought was 100% covered, you wake up and discover, oh my goodness, it wasn't preventative at all. So don't be mad at me if you get that bill. That's because your doctor took a polyp out during the procedure. But they do warn you about that before they put you under for it. But other things could be if you've not had a mammogram this year and you say, I think I feel a little something. Well, it's now diagnostic. It's all about how the doctor codes it. It might be the same test, but now they're looking for something specific instead of just a general screening. So if it's just a general preventative wellness exams and things like that, those are covered at 100%. So please get your preventative care done. Medicare does a great job. They have a long list. It's on the back of your Medicare Basics. There's a list of preventative screenings that you can have done annually. One thing that's also included in that is an eye exam for eye health. So yes, it does not cover acuity. It won't get you a pair of glasses under original Medicare, but I promise you can go get your eyes looked at for eye health. So you can check for things like glaucoma or what are other things that have cataracts, things that are eye health related. So your eyeballs are covered, but just not your vision, if that makes sense. So, yes.
If you've been diagnosed like with glaucoma, will it cover all the treatments and the tests that they do to track that?
Yes. Yes. Eye health is covered under Medicare. So I think that's really good.
And that's the Advantage plan or supplement?
Well, Advantage plans have different rules. So you have to follow the rules for them. Okay, so I know you might have heard a little bit about the Inflation Reduction Act and how insulins are $35 or less for everyone on Medicare. So the thing that I will point out to you is that the Inflation Reduction Act did a lot of good for Medicare drug costs, but it didn't go 100%. So just because you have Medicare does not mean every insulin will be covered by every plan at 35 or less. So when you are looking at this, do not say, oh, well, all my insulin's going to be 35 or less regardless of the plan I choose. That's not how it works. The insulin has to be on the formulary as a covered item. So all drug plans are required to cover at least one insulin for 35 or less, but not all insulins on all plans. So you still need to make sure that your plan covers your specific insulin, and then you'll get it for 35 or less per month, and that's good. And a lot of them are actually less than 35 per month. Depends on the plan you pick. I think my mom pays like $10 or $11 a month for her insulin. Depends on the plan, right? So And in addition, we have expanded eligibility for that low-income assistance extra help program we were talking about earlier that can reduce or eliminate your drug costs. So we want to make sure that if you come into a SHIIP counselor, for example, we're going to screen you for that. We're going to ask you nosy questions about, is your income less than this amount? Because if you're in this ballpark, we want to apply and see if we can help you save that money. It's not because we want to know what you make, it's just because we want to make sure we're helping you if you need help with that. Also, if you do get to, I know everyone's heard of the donut hole, the dreaded donut hole. So if you fall into the coverage gap in your drug plan coverage under Medicare, at a certain point you fall into what they call the post-coverage gap, what they used to call catastrophic coverage. When you fall into that category now, you don't pay anything for drugs. Drugs are free. So there is a maximum out of pocket, in essence, for all drug costs under Medicare, which that is a great thing. Now they are working to add on, as the years go by, you'll see more and more drugs added to the list of negotiated pricing, where we will see Medicare clamping down on the cost of specific drugs. So right now they focus on insulin the first year out. They'll bring others on board as we go. Now, I want to kind of make a plug for one thing that SHIIP is also associated is the North Carolina Senior Medicare Patrol Program. And so SMP is a program that helps prevent healthcare fraud, waste, and abuse. And what we do is education and outreach that help you learn how to not only prevent, but also identify when you've had Medicare fraud and what to do if you detect it. So we can help you report it and get that fixed. Because we lose $68 billion a year to Medicare fraud. That's a scary number, y'all. That is an unsustainable amount, in my opinion. We cannot allow that to continue to happen. So we have to learn how to protect ourselves and detect medical fraud and errors and report them and get them corrected so that we can get that $68 billion down. Now, the one thing that we do when you come to SHIIP is we create a Medicare.gov account on your behalf. If you haven't already created one, we'll assist you with that. But we're going to encourage you to use Medicare.gov because it's one of the big ways for you to prevent that fraud that we were talking about. By going in there, you can see all the things filed against your Medicare and you can detect it and report it quicker. But it also lets us look at that plan finder. We can input all of the medications that you take. We can check your providers to see if they're in network with Advantage plans. We can make sure all your drugs are on the formulary list for your drug plan that you're choosing. And we can give you all the information that you need, as well as many resources that answer all kinds of questions for you. So when you create this account, or if we create it on your behalf, we can help you see how you can use it to pay your Medicare bills, to look at your summaries electronically, to avoid things being sent to your home. You can just receive them in your email if you prefer. You don't have to. You can also obtain printed copies of your Medicare card if you destroy it, because it is paper.
You have to have your Medicare number to get your
You do.
Medicare.
Yeah, you'll have to have a number to get it. But you can also see that calendar of preventative services. So if you forget what you should be doing or what services you can get, you can see that on there. And then if you listen to this presentation, you thought, man, I could help people with that. I could do that. We are always looking for volunteers to offer Medicare counseling locally. We give a very great training program. We'll walk you through a long amount of training, but in the end, you'll be able to sit down with folks, and it feels really good when you can help someone make those Medicare decisions that are so important to their lifetime health, in addition to saving them tons of money, because a lot of times we can save people lots and lots of money by helping them with programs or picking better plans that suit their needs more appropriately. So if you want to become a volunteer, just see me afterwards, and I'll help you get that application. But I do want you to know where you can get help. So you can always call the Seniors Health Insurance Information Program, and we're located in Raleigh, 855-408-1212. It is toll-free anywhere in the continental United States, Monday through Friday, 8 to 5. And you can look it on our website, www.ncshiip.com. You can also call Medicare, nationwide toll free, and the Social Security Administration. So I put those contact numbers up there for you. But the thing I will say about the Social Security number that's listed in this, it is the nationwide call center located in Virginia. You will actually get through quicker if you call your local office. And you can go to ssa.gov to find your local office phone number. And of course, the Medicare New Handbook. So once you get signed up for Medicare, you'll get one of these automatically every year. That's kind of your owner's manual. And I always encourage people, when you get it every year, don't just throw it down and use it as the thing underneath your table to keep your table steady. Take that thing out and look for what's changed. At the beginning, every year they put what's changed, what's new for this year. Look through that. And in the back, because you're in North Carolina, you'll get the landscapes. That's what we call them, but it's all the plans available for drugs and advantage plans and all the different, like the premiums and the co-pays and all the things that you need to know about it are in the backs of those books. So it's a really good idea to take a good hard look at those, right? Because that's going to kind of educate you about what's out there and what's changed. And you can always just call us, because we're your cheat sheet. We'll help you too with all these questions. And you can actually email us at ncshiip@ncdoi.gov or email my personal email, billie.lister@ncdoi.gov.